Hello, welcome to Remaking Medicine, where we have incredible conversations with people who are working across the world of healthcare to help us think about innovation and change and curiosity about what is possible in our sector. And I am really glad to be here today with Brooke Evans, who I have had some great conversations with already about the world of medical humanities and specifically visual arts in medical education. And so please, Brooke, introduce yourself and tell us about your program, and then we're going to dive in.
Awesome. Well, thank you for inviting me, and thank you for your amazing book. I enjoyed reading it and just all the inspiring projects that were a part of it. So my background is in art history and education, and I worked in museums for many, many years and sort of had my aha medical healthcare moment in 2011 when I was at the Museum of Fine Arts in Boston, and we started working with clinicians at Brigham and Women's Hospital, doing a program that really focused on sort of the humanistic side of being a doctor. The residents had just started their residency program and, had gotten all that great knowledge in medical school, but now we're working directly with patients on a regular basis. And so their program director wanted to create a program that included the visual arts to learn about things like empathy and curiosity, kind of build skills around communication and observation. And I actually just got pulled into teaching it because I was teaching at the museum at the time in the education department. And it sort of blew my mind. I was like, oh my God, you can use the visual arts for helping to really enhance another profession. And so long story short, I worked on the medical and visual arts programs at the MFA for many years. And then in 2021, was recruited to Brigham and Women's Hospital to do this work full time. So now my full-time job is designing workshops for clinicians across the hospital system and even admin people as well, really anyone within the hospital, using the visual arts for exactly as I was mentioning, kind of enhancing skills, building skills. And then another part of that is doing some research and some writing about using the visual arts in healthcare and sort of the impact that can have on healthcare training. And then in 2022, Dr. Katz and I, Dr. Joel Katz, founded the Center for Visual Arts in Healthcare at Brigham and Women's Hospital. So that's where all these programs live, where the research lives. And it's really a culmination of the work that Dr. Katz has been doing for over 20 years. He was the person that created that pilot program back in 2011 that got me sort of hooked on this work. So a lot of credit goes to him for really being pioneering in this field.
Oh, it's wonderful. And I think we have a picture of.
Yes. Yeah.
So we're getting really AV advanced today. We're putting Amber from our team to work with showing some AV materials. So we'll see. She can bring that up at some point here. Yeah, I mean, I think, this is such a powerful moment for really rethinking education in general. I was just listening to Ezra Klein's conversation earlier this week about the future of education in this moment of AI and how AI and the way that it has just burned like a wildfire through the methods of teaching, of the idea of like reading something, interpreting, writing an essay being like the high point of education. I think especially for me, medical education and the way that we train doctors is so intense and also so different from the way that the rest of professionals come up. Were you surprised when you got into the world of medical education, like what that process was like? Coming from like an art background, I would imagine that would be quite a culture shock.
Yes, that has definitely been a big part of my learning curve is adjusting to this new world of healthcare, and it is very different from working in the humanities and being at Brigham and Women's, such a very large hospital. So kind of adjusting to that large organization as well. But as some folks have said to me, I'm sort of like a unicorn, this little island of visual arts within the healthcare world. So I've really been able to kind of hold on to that and bring that to as sort of my contribution to both the medical school and the hospital. But it's it's an environment that has a lot of demands and a lot of there's a lot of burnout. I think there's a lot of just requirements. And so trying to fit a kind of a new idea of bringing the visual arts in can be tricky sometimes because people are just really busy. But I'm thankful, both at the medical school level and at the hospital level, I've had some amazing advocates and champions that really believe in this work. And so kind of through word of mouth, we've been able to really expand the visual arts in both the hospital and the medical school.
Tell us about one of the workshops that you've done recently and kind of how that's structured.
Yeah, so one that I'm very excited about is I've had an opportunity to work with nurses more. And I have a lot of nurses in my family, so like they're very near and dear to my heart. And the work that they do, is just amazing. And so we've been able to work with some nurse residents at Brigham and Women's Hospital. So they come in and they do a 1-year residency program that both focuses on sort of the clinical side of being a nurse, but then other kind of skill sides. And I'm working with the nursing leadership to do one workshop for each nursing cohort at the museum. We do these at the Museum of Fine Arts in Boston. And it really focuses on communication. It focuses on nurses really finding their voice in the clinical setting, like how to feel confident speaking for their patients and feel confident in the knowledge that they bring, and really emphasizing the role that they play on the clinical team. And so we've been doing that for about a year now with a variety of the cohorts that have come through. And we're actually expanding it to do a pilot with nurse residents and medical students together, doing a workshop, focusing on team building and just focusing on, again, understanding each other's roles in the clinical context.
The team building and collaboration is a real obsession. I have a lot of obsessions about the way that we train physicians and clinicians and the way that we have them working. But I just gave a talk about RVUs in a recent, and the way that we compensate for productivity in medicine, and it's individual productivity in most cases. And really, I think that it's, as somebody who gets to kind of stand in both of these worlds, from like a technology business world of Silicon Valley where I came up, and then as somebody who's kind of a groupie in medicine, it is so fascinating to see these different mechanisms of how, like, what we reward in medicine, and how not only are we not rewarding collaboration in most settings, but we are actively compensating against collaboration. And for me as a patient, like, that is the last thing that I want, is for my doctors to be incentivized on the units of work that they can produce in a day. I would much rather have my doctors go out to lunch together and actually know each other. Like, if it was, my own money, if I was going to run a hospital. And so it seems like your kind of program fits really well into pushing against that, right? Oh, hi, Amber. Hey,
sorry.
We love to have you popping in. That's the wonderful, amazing Amber, who's part of our team and makes this all happen. But back to that idea of, like, is there resistance because it's so different than the way that people have been trained up through their education at that point? Or do you feel like people are really eager and open to that? Like, What is that kind of team building? How is it received?
Yeah, it was. So in this instance, it was received really, really well, actually
Yeah.
better than I had hoped.
Very
We had it was a small group of maybe about 12 people all together.
good.
And we did some surveys after. And one of the things that, this is another actually team building workshop that we did that I can explain in a minute too, also with nurses and doctors. But, for the medical student and nursing resident one, the medical students especially said, we don't get the chance to meet the nurses until we're on the clinic. Like it's like in
Mhm.
that hospital environment, you're suddenly thrown together
Yeah.
and expected to work together successfully without without knowing each other and knowing each other's, specific. I mean, you understand everyone's roles, but really getting a chance to learn better and deeper. And the medical students really appreciated that, understanding the background of the nurses, like what is their training, how do they get into nursing, what's their
Mhm.
motivation for being in healthcare. And I think similar, for the nurses, they got to really like explain their role and share their experience with the medical students. So it
Mhm.
was really valuable. The picture that you just saw that took place in the museum, but we also do some art making. And for this, we invited in an artist, a local artist. Her name was Laura Minucci. And she created a workshop for, these were sort of more experienced sort of nurses and clinicians in the cardiac care unit. So working in a very stressful environment within the hospital, a lot of
Mhm.
like life and death decisions happening. And we wanted to give them a chance, similar to what you're saying, just to
Mhm.
take a break, to get to know one another, on a personal and an individual level. So they're each making these, they're sort of prints using a stamping technique. And then they had some questions at their table where they got to know each other better during the process of creating
Mhm.
their art together. And then they had dinner after. And I remember one doctor, I think, said that the nurse that they had worked with during this art making came up and gave them a hug afterwards because they were
Mhm.
so happy to get to know them on this different level. And
Mhm.
so things like that I find really meaningful.
Oh, I mean, yeah, just again to like harp on the difference of these two worlds, like coming up in Silicon Valley, this is like every day in a Silicon Valley tech company, you're doing
Mhm.
art workshops and you're getting together and you're having meals and you're such a focus on culture. Um,
Mhm.
and I just love that that's coming into medicine now
Mhm.
again, and like that investment and having people know who they're working with and know, it is a busy setting with hospitals, people coming and going in different shifts.
Mhm.
Trying to build that kind of relationship is powerful. And art seems like such a unique catalyst for that kind of
Mhm.
experience, right? Because you could get together and play softball or do something else.
Mhm.
How do you feel like art is really like uniquely well positioned for that?
Yeah, it's interesting that you asked that because I was actually just meeting with some colleagues yesterday talking about this because we are doing a sort of longitudinal curriculum with psychiatry residents. They go
Mm-hmm.
every year of their residency, and we go to the Museum of Fine Arts and do a workshop together. And one of the takeaways, we did some focus groups with them, was this chance again to really know their colleagues better, and to get experience an activity outside of the hospital environment. And to your question of, why the arts instead of like, Fenway Park is huge here. Why not go to a baseball game? And I think art affords a lot of different opportunities from really hearing multiple perspectives. So we're talking about a single work of art, and everyone's kind of sharing their perspectives, their background, what they're bringing to that discussion. And so that's a chance for that sort of community building to really shine. We also do a lot of self-reflective activities, which gives each person sort of individually time to reflect and to think, but then they share out to the wider group. So it's an opportunity to learn more about your colleagues through that reflection, through what they're kind of taking away from looking at the work of art together. So I think art also, I think, forces you to slow down, especially in this kind of structured environment where we're doing these, facilitated programs where we spend a concentrated amount of time with one work of art. And so all of that, I think, really contributes to that community building.
I love that so much. I wish that every hospital, every person who was in charge of a team in medicine could do this. And so actually, that's my next question is, for people who don't have an incredible funded, long-lasting program like yours, but who might want to try something like this, have advice of, is there a starter kit?
That's a great question. Yeah, my pie in the sky goal is to have a position like mine in every hospital across the country. And kudos to Brigham for it is pretty pioneering to have this type of position in the hospital. There aren't many. There's a lot of folks that work with patients using the arts. There's obviously a lot of hospitals that have wonderful art collections, but for someone who works specifically with clinicians and using the arts is more rare. But the starter kit, I would say, there are so many amazing museums, art galleries, art collections around. I would encourage clinicians who are interested in this work to maybe reach out to their local museum and museum education staff. Museum educators were always excited about new ideas and willing to jump in to do things. So that could definitely be a place to start. There's a lot of really good articles now. I would say, in the 13 years that I've been working in this, the amount of scholarship around using the visual arts in healthcare training has really grown quite a bit. So there's a lot of research and information and kind of how-tos within those articles that people could access as well. But I think, for me, it's really that partnership between the healthcare provider and myself as the art educator that I think makes these programs so successful. And I'm so grateful for my health care colleagues and their work and their belief in this work too. Because I can preach about art until the cows come home. I've obviously, really believe in what the arts can do, but I think having that healthcare provider also say, this is something that is valuable for your very busy time, and encourage it has been really beneficial.
And because you come from an art history background specifically, which there is a long history of art and medicine together. Is that part of your toolkit of kind of how you introduce this as well, as like that deep, really, really long history of connection?
Yeah, it really is. It's so interesting. I had the very fortunate experience of being in Siena, Italy, in February, and we went to this old hospital it's no longer functioning, but and it had just floor to ceiling frescoes and just beautiful works of art in them. And it just made me realize like art and medicine were so intertwined and, and in some cultures still are. But I think in sort of Western culture, we've separated them out. And I'd really love to see them come back together. And I think we're getting there. I think there, are some, as I said, amazing hospital art collections. There are programs like mine that are bringing the arts into training. Arts on prescription is growing in the U.S. Based on work done in the UK and other countries. So, I think we're moving back together, but still, there's still more room for that to grow.
So, do you ever get pushback? It sounds like everybody loves this and it's incredible and it's perfect and everyone should do it. But, when you do encounter some hesitation, right? Like, what does that usually focus around?
Yeah,
Yeah.
no, I mean, for sure.
Mhm.
I'm very fortunate, and there are lots of, as I said, advocates and champions of this program in
Mhm.
Massachusetts, in Brigham and Women's Hospital, but certainly not everyone has bought into it. And it's interesting. I actually do a program for first year medical school students at Harvard Medical School, where they are all required to go to a 2-hour workshop at the Harvard Art Museums, where we focus on things like communication skills. This is a drawing activity that we do in the galleries. And because it's required of everyone, so that's about 170 students, there are
Mhm.
definitely some in there that are like, I don't understand why I'm in an art museum. Like, what is happening? Like, what does this have to do with my medical education? And, for some of them, we convince them that it's worthwhile. For some of them, they're still like, nope. I don't see the purpose of this. So,
Mhm.
we're never going to convince everyone. I think that this is valuable, um, but as I said, there have been some
Mhm.
students who have come in saying like, "Why am I here?" And then leaving saying like, "Oh, I really appreciated this." And it could be just something as simple as, when students go to med school, I feel like they often tell me like they, stop playing music, they stop making
Mhm.
art, like they're just so focused on their studies. And so doing something like bringing them to the art museum for 2 hours, they kind of remember like, oh, there's this other side of me that I really liked and I want to bring back in. And so, maybe they'll go to an art museum more often, or they'll start drawing again or playing music again. It could be as simple as that. Others, find it really valuable in terms of reflecting on their medical school career and kind of getting to know their colleagues better. I would say, um, there's definitely, people who have that kind of aha moment,
Mhm.
and people who don't, people who I still won't convince. And I think the other barrier that's challenging is time.
Mm.
As I said in the beginning, clinicians have so many demands on their time. And so being able to find out where this program can kind of squeeze into that very hectic day can be really challenging. The nurse program that I mentioned at the beginning that we started, it maybe took us about 6 or 9 months to get that off the ground because it was
Mhm.
just a matter of finding time in the nurse's schedule. So
Yeah.
that can be tricky.
There was a really fascinating study recently where the way that they set it was very clever, but they basically showed that people who feel really busy, who feel like they don't have time, are less capable of acting ethically.
Interesting.
You lose, like, that's kind of one of the things when you're like survival mode, like going
Yeah.
fast, that you're like,
Right.
I can't make
Right.
these, like, sit and have a time for like a complex moral ethical
Mhm.
decision.
Mhm. Mhm.
Art is incredible vector
Mhm.
for that, right? Inviting
Yeah.
back in that ability to think about things, right?
Right. Yeah, and I see that all the time, when I ask for sort of feedback, like, "What are your takeaways from the workshop that we just did together?"
Mhm.
A lot of people will say, like, "I feel like I can see my patient as a whole person now." I think to your point,
Mhm.
they're so pressed for time that they're kind of just focused on, like, what do I need to do to help this person?
Mhm,
What's
mhm,
the answer? And to, the reason why they came in. And these workshops give them that opportunity to really slow down and think about like, okay, like, yes, I need to solve this issue, but like, who
mhm,
is this person as a whole person?
mhm,
And even, on the team building side, like, who is my colleague as a whole person? Like, they're not just like, someone who's going to help me get to an answer, but what else about them can I know? What's this sort of holistic
mhm,
view of both colleagues and patients?
mhm. Have you gone beyond the physicians and nurses into other people in the hospital? I know in Baylor, they've actually started inviting the food service workers
Mm,
to
mhm,
their ethical, like, roundtables that they do, and they found that the food service people actually have really incredible insights into what might
mhm.
be happening with the patient.
Yeah.
But
Oh, I
they're
would
not.
love that. And that, that is one of our goals when this position was created, like to work with the entire hospital.
Mhm.
I have taken a sort of dipped my toe in working with other folks. I actually got to work with spiritual care providers earlier this year, as well as translation services.
Ooh,
And
wonderful.
so they're all very different. Nurses are different than working with doctors, and
Yeah.
spiritual care providers different than working with the translators. But, I think the general themes that came out of the workshops were always the same. Again, that idea of using art and using this time together to build community and to get to know one another better, and to slow down and to reflect on their work.
Yeah. And so what have you been surprised to learn back from the medical world? Have you changed, how you think about medicine or your own health, or, what surprised you back as somebody who, is giving the lessons, but also receiving the lessons?
Yeah.
Mm.
I think a couple of things. When I first started this work, way back in 2011, I think it really struck me, just the human side of doctors.
Mhm.
Whenever I went to the doctor, it was like this
Mhm.
person, like up on high, who sort of knew everything.
Yeah.
And I think that, they still, obviously know a lot and have a lot of knowledge that they're bringing, but realizing that, especially for the residents who are on the younger side, they're in their early 20s, like they're, they're also kind of just trying to figure it out as they go along as well, trying to understand and care for their patients as best they can. And, like all of us, they have their
Mhm.
doubts, they have their good moments, they have their bad moments, they're human. And I think we put so much pressure on them to be superhuman.
Be perfect.
And to
Yeah.
know everything and to
Mhm.
have the answer. And at the end of the day, they are people that,
Mhm.
like all of us, have their good days and their bad days. I think the other thing that I really learned, and so appreciate about, at least working within Brigham, because that's the environment I have the most experience in, is just how passionate they are about caring for their patients,
Mhm.
and really wanting to do the best that they can do in a really challenging
Mhm.
environment of, not a lot of time, a lot of demands, again, being expected to know everything about everything.
Yeah. Yeah. That
um,
culture of perfectionism is very pervasive in medicine, and I love the idea of art, which is, even the most beautiful, photorealistic painting is never perfect, right?
mhm.
Never be perfect, and that
Right.
giving people permission to be a little outside of that world.
Yeah. Yeah, and that sort of be vulnerable.
Mhm.
One of the activities that we do is, it's called personal response, and it was created by my colleague Ray Williams, who works in
Mm.
Texas. And what it is selecting a question prompt and then asking people to find a work of art that connects to that question. So
Mm.
when I use this a lot for the intern residents, so first year residents that I work with, and we ask them, find a work of art that connects to how your intern year is going so far, how you're sort of feeling about your intern year.
Mm.
And and they share so much about the challenges and the struggles about being a doctor in residency for the first year. But what's really nice about it is they're sharing it among their colleagues. Some of them for the first time. Like some of them are like,
Mhm.
"Oh, I feel that. I had no idea you felt
Mhm.
that."
Mhm.
And so to your point of that vulnerability, like
Mhm.
the art allows for that vulnerability that, I think the hospital environment does not.
Yeah.
And so it's a nice chance again to connect and to know
Yeah.
you're not alone in feeling that way.
Yeah. I love doctors. They're so weird. I love medical professionals. Genuinely, like, really, really do want them to have a better work life,
Mhm.
right? I mean, I think it will be so much better for everybody. I've had that
Mhm.
experience as a patient, I'm sure you have as well, where you go in and you're like, this person hates their job.
Yeah. Yeah.
And they're going to stick a needle in me, or they're going to tell me something really hard. And I don't want this person to hate their job.
Yeah.
Right. And it's like,
Yeah.
what can we do? It's not a compensation thing necessarily,
Right.
because I think, at the end of the day, the dollars are good, but
Mhm.
it's the structure of that work environment and how
Yeah.
they are compensated, how they are asked to work together or really not ever work together.
Mhm.
That idea of having to be perfect and never make mistakes,
Yeah.
not show emotion, this is just the part of medical culture that I wish I could like snap my fingers and change
Mhm.
it. Right.
Mhm.
And there are examples of, there are counter examples, right? I think we've all seen, specific little pockets within a big hospital or health system where there's an incredible leader
Yeah.
who really has like carved out a little world
Yeah.
where people know each other's birthdays and they know what's going on in each other's lives. I think Mayo Clinic's a really interesting
Mhm.
example. I don't know if you've researched and gotten into the, sort of the cult of Mayo and how they make decisions there. I don't know that they have any arts connection, but they specifically hire and filter for collaboration.
Mhm. Mhm.
And they specifically use the founders, Charles
Mhm.
and William, and they say in these difficult meetings, instead of, how do we perform the HEDIS thing that we need to do,
Mhm.
they'll sit and they'll say, what would Charles do in this situation?
Mhm. Mhm.
Do in this situation, which in a way is like a very artistic thing, right? So be like envisioning this founder like looking on you. What
Right.
other like signs of great hope are you seeing outside of maybe your program? Even like, are there departments or areas that are really like evolving very quickly in this way?
Yeah, I would say, there's lots of exciting sort of centers of work. Johns Hopkins is doing work on neuroaesthetics.
Mm-hmm.
The University of Florida has a Center for Arts and Medicine that's doing some amazing work. There was actually a report that came out of the AAMC, maybe in 2019, which is sort of the body for medical colleges, called the Frame Report, which
Mm.
was let me see if I can remember what that stands for, the fundamental role of arts and health, in medical arts and humanities, rather, in medical education.
Ooh, okay.
And it was a whole report kind of outlining the importance of using the arts and humanities in medical training, what that looked like, what the research was that supported it. Really very comprehensive kind of study of why the arts and humanities should be included more in medical training. So I think having physicians organizations like that really promoting this work is really valuable,
It's
because
huge.
people who maybe didn't take notice before will take notice now.
Yeah.
um,
Yeah. And again, with this time that is fraught and feels, a little dangerous with AI
mhm,
coming
mhm,
in is really opening up, I think, new energy around the humanness,
yep.
right? That is so fundamental because, anybody who says we can just replace doctors with AI has not been sick.
Right, right, right.
Not experienced, having to have a deep ethical conversation around end
Mhm,
of life care as
yeah.
a physician and how far you go and what you would choose for yourself if you
Mhm,
were trying to advise somebody else. And
mhm,
um, I feel like there's such a portal kind of opening up for people in medicine, especially medical education right now,
mhm.
to say everything is changing. Like,
Yeah,
let's change everything. Like, let's
right.
see what we can do to make this a different experience going forward.
Yeah.
Yeah.
Yeah, and I think students also are really strong advocates for, like, they want
Mhm.
their curriculum, their education to be different, and I think are really taking,
Mhm.
taking kind of a leadership role in, like, how can this be different for
Mhm.
us than, it was for people who came before us.
Yeah. Yeah. So tell me about like what's coming next for the program. Are you trying any new big innovations? It's just steady as you go. Like, what's happening next in the next like year or two for you?
Yeah, so our next big exciting thing is we are in the midst of planning a symposium for 2026, focused on arts and healthcare, specifically visual arts. And it's going to have a real strong research focus, because that sort of the area that I think people in the field have identified maybe isn't as strong, and is also really valuable for convincing, again, people who haven't bought into this why this might be important, and why, to carve out time for it. And so we just funded some research projects that will be part of that symposium, from some colleagues within the Mass General Brigham system and Harvard Medical System. So I'm really excited about that, and kind of see where those projects will go, and see what everyone brings to the symposium. We've had a few of them over the years. And it's such an invigorating environment to have, to bring both the healthcare side and the art side together for, these two intense days. Or 3 days. So that will be in September of 2026.
Nice.
So that is, that's definitely on my to-do list.
What kind of research is most exciting? Are you allowed to kind of hint at some of the things that might be coming?
Yeah, so there's a couple of projects working with medical school students, and using the arts to train on different sort of illnesses, and kind of understanding, using the arts rather than, giving people like a chart of like, here are the illnesses, memorize them. Looking at a work of art and kind of using your detective skills and your knowledge to really understand, okay, maybe what is this work of art portraying in terms of this illness? So that's a really kind of exciting area. I'm also working on a project using a sort of art discussion methodology called visual thinking strategies to help enhance clinical reasoning skills for interns. And we're collaborating with Virginia Commonwealth and UNC medical schools on that project, and both working with our interns in a 4-session curriculum using art and clinical cases to help enhance those decision-making tools.
Oh my gosh, that sounds really exciting. It's such a weird challenge to try to prove with research the value of art, which is like the oldest, thing that humans have ever been doing since fire.
And it's hard, I think there are arguments that, within sort of the medical world, you want to quantify things, and within research, but sometimes it's hard to quantify the arts. Like,
there's a legibility there,
right?
That gets to like the depths of the human soul, and that is a challenging place to create like a table.
Yeah. How do you really quantify these experiences that, are so individual, and that it's so, there's a lot of qualitative data in the work that I do.
Well, and I think we know anecdotally that these kinds of experiences make for somebody who can probably last longer in their career, who can find their way out of burnout and fatigue and moral injury. And so, hopefully there's a way to prove that, and be able to make that, in the literature as well as in our own experiences.
One of the other studies we're doing is kind of looking at people who have been involved in an arts curriculum, several years out from that curriculum, and kind of what do they still use? What impact has it had on their practice? To your point, like, has it helped with burnout? Has it helped, with communication? And so that's another kind of exciting study that we're in the process of writing up.
There's probably research out there. I'll have to try to go find it if you don't already know of it off the top of your head. But because there is like a small cohort of people who come from a humanities undergrad into medical school, which is a heavy lift because they still have to learn all the science side. But I wonder if do the people coming from a humanities undergrad stay in medicine longer or not?
That's an excellent question. That would be really interesting to see. Because there are, I mean, as I mentioned earlier on, so many musicians who
Mhm.
medicine, and
Writers,
right, yeah,
historically,
right,
classically, yeah.
right.
Yeah.
Yeah, that's a great, and do they practice their arts, still,
Mm.
or do they stop practicing their
Have they
arts
completely
with that?
flipped over to the science side?
Yeah, yeah,
Yeah.
yeah. It's a great
We'll
question.
have to see. We'll go look it
Yeah,
up.
that's your next
Google scholar it. Oh, well, we're almost near our time. I want to hear from you again. Give us the like where we can find more about your programs. Give us
Sure.
the URL. We'll put Amber on the spot here to run the Chiron again. But where can we find out more about what you're doing?
Yeah, so I would say go to our website, which should flash across.
Oh, yeah,
Yay! Thank you, Amber. On there, we talk about our programs. We also have research that we've been working on and other folks in the field have been working on that we highlight. And I also try and do a semi-regular blog, inviting in writers as well from outside to talk about their experience in arts and healthcare. So try and keep it kind of up to date. And we also have a regular newsletter, so people can sign up for that if they want to.
Wonderful. We do. We need those daily doses of inspiration or
Yes.
weekly doses of inspiration to keep us going.
Definitely.
Yeah. And so then the final question is just tell me about some of the things that are inspiring you right now that you might be reading or watching or appreciating in the visual arts that we could go check out.
Yeah, that's always a great question. I mean, I'm so lucky to live in Boston, which has amazing museums
Mm.
and arts. My husband is in theater, so we go to
Mm.
theater quite a bit. But I'd say maybe my favorite exhibition at the moment is an exhibition of John Wilson at the Museum of Fine Arts. He was
Mm.
a Boston-based artist who was amazing. He was like a jack of all trades. He did painting and sculpture and printmaking and wrote children's books. And really tried to sort of speak about his experience as a Black man, as a
Mm.
father. He talked about social justice and economic justice in the world, kind of using his art to tell people's stories. And I think it's such a great example of how art can like elevate and tell a story and bring things to light in a very beautiful way. His work, I think, is shows so much talent and so much beauty as well as sort of these important messages.
Mm. That really aligns with me with, I think, the transition that we're having both in the profession of medicine as well as an artist world, of recognizing the artist not as this like solo genius who's outside of the world, but as who like is a whole person.
Mhm.
I just saw the Ruth Asawa exhibit here at
Mhm.
MoMA in San Francisco, and I've never seen an art exhibit that's so fully just like documented or included somebody's role as a parent in
Mhm.
that. I have even artists working right now who are friends of mine who don't acknowledge the fact that they have families because it's
Yeah,
not
yeah.
part of like that vibe. But
Mhm.
this Ruth Asawa exhibit, she had her studio in her house so that she could make peanut butter and jelly sandwiches for her kids, making things. And it's this beautiful moment of like, of course, these are whole
Mhm.
people. Of course they
Right.
are. And of
Right.
course, that richness that they get from going to PTA meetings and
Mhm.
doing sculptures. And I think, that's a beautiful lesson, I think, in the profession of medicine as
Mhm.
well, that we're really learning right
Yeah.
now is that we as patients, I will speak for all patients everywhere, want our doctors to be people. We know that you're
Right.
people. We are not fooled
Right.
by
Right.
the white coat to think that you are not a person.
Yeah, and really, allow them to be whole people, like,
Yeah.
to have that life outside of medicine, to raise the family,
Mhm.
to do their art, to do,
Yeah.
whatever, just to have that good balance. I think
Yeah.
that sometimes we don't always allow in such busy, important work environments.
Yeah. Oh my goodness. Well, Brooke, I'm so grateful that we got to talk again. And
Me
I'm so
too.
grateful just that your program is growing and thriving and really setting this very academic, evidence-based bar for the world of art and being whole people in medicine and creating workplaces that people don't hate to go into and professions that people don't regret entering into. And it just is going to make such a huge difference for this next generation. And so I hope, by the time we are old and in a hospital, our
Right?
doctors are people who are interested in art and who are beautiful people. And
Yeah.
it's just a wonderful change that you're leading in the world.
Well, thank you for giving me the time to share it and share with everyone in your audience. And again, thank you for the work that you're doing. I think it's really amazing and bringing another spotlight to how the arts can change healthcare.
Wonderful. All right. Well, thank you, everybody. We'll be back again very soon for a conversation actually about prescribing art, which we mentioned during
Mhm.
this. So stay tuned for that. And thank you, everybody, for continuing to be hopeful humans about the future of medicine.